When someone said, "Expect the unexpected," I don't think they had the year 2020 in mind. So in spirit of the new year, we will be giving out a few notes on how to reconnect with your mind and body and how to prioritize yourself. As you may have heard many times, you cannot control the things that happen to you, but you can control the way you react to them. 2020 was greatly altered due to COVID-19. Many lives were lost. Widespread lockdowns, high unemployment rates, food, and housing insecurity made this past year a very difficult and heavy one. With all of this, it is no surprise that there has been an increase in the rates of stress, depression, anxiety, and substance use this past year. Mental health encapsulates our emotional, social, and psychological well-being. It has an impact on how we feel and how we act. It impacts our ability to handle stress, socialize, as well as make choices. Mental health issues are very common in the United States. An estimated 50% of all Americans are diagnosed with a mental health disorder at some point in their life. 1 in 5 American adults annually report suffering from a mental health issue, while 1 in 25 report having a serious mental health disorder that affects their ability to participate in major life activities. According to reports from the CDC, 2 in 5 American adults have reported mental and behavioral health issues since the start of the pandemic. Of nearly 10,000 adults surveyed, 31% reported symptoms of an anxiety or depressive disorder, while 26% reported a trauma or stressor-related disorder associated with the pandemic. Certain populations, such as people of color, essential workers, caregivers, and those with pre-existing conditions have been disproportionately affected. Depression is a mood disorder that can cause a constant feeling of sadness, disinterest, and can interfere with daily functioning. It can be caused due to several factors, such as stressful life events or issues with mood regulation by the brain, to name a few. Depression is also linked to increased stress hormones and lower levels of those feel-good hormones such as endorphins and dopamine. Anxiety is the mind-body reaction to stressful, unsafe, or unknown situations. Small, brief amounts of anxiety help us remain aware and productive, like being a little nervous before an exam. However, sometimes anxiety can lead to extreme feelings of being overwhelmed, panic attacks, and other anxiety disorders. Physiological aspects of anxiety can show up in the sympathetic nervous system, which handles our fight or flight mode. Fight or flight is our body's response to an event it perceives as threatening. It evolved as a survival mechanism and makes us extra alert. However, unfortunately, this reaction can also be activated in response to non-threatening everyday life stressors. On activation, the sympathetic nervous system causes high blood pressure, sweating, and increased heart and breathing rate, along with pupil dilation, increased production of adrenaline, and indigestion. This may lead to discomfort in your stomach or loss of appetite. Along with adrenaline, another hormone produced is cortisol, the stress hormone, which is secreted by the pituitary gland in the brain when we are overwhelmed or stressed. Too much cortisol in the system increases stress. Excess stress and anxiety, especially over a long period of time, can lead to inability to think clearly and can also increase our risk for other diseases. If you are experiencing any of the above-mentioned symptoms, it may be hard and/or enlightening to find a name for your experience. Mental health presents itself differently in everyone, and we recommend you seek out a provider for more support and guidance. Some folks come from families or communities where mental health is stigmatized against. Please know that you are not alone, and what you're feeling is absolutely normal and okay. Although anxiety may not completely go away, there are some ways in which we can navigate or learn to work with it to improve our overall mental and physical well-being. When you are feeling stressed or overwhelmed, here are some ways to take care of your body and mind so that they are better in sync. Identify what you are feeling and allow yourself to feel the emotion without being too hard on yourself. Remember, it is okay to not be okay. Emotions are complex and you can be feeling multiple emotions at one time. It can be confusing. Identifying or naming an emotion is known to allow one to better work through them. Vocalize the feeling or write it down. Talk it out with yourself to better reflect. Express yourself. This is an emotion wheel. Here are some different ways that can help describe emotions. Grounding techniques can also provide a way to relax and recalibrate. One such technique involves naming 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This helps you focus on the environment around you in the present moment and can take your mind briefly off of whatever is leading to feelings of anxiety. It can allow one to picture the situation more clearly and improve decision making. It allows you to collect your thoughts and become more relaxed. It can also act as a barrier to unhealthy thought patterns. Another technique involves using your breath to calm yourself. Your breath is your lifelong companion and can be used to your advantage even during tough times. Inhale to the count of 4. Hold till the count of 4. Exhale till the count of 4. Continue until you feel your heart rate slowing down. If focusing on your breath doesn't feel comforting right now, find a different sensation to focus on, such as the rise and fall of your stomach or the sensation in your toes. Connect yourself with friends and family who lift you up. Though the pandemic has made it difficult to meet loved ones, you can always text or call. Schedule weekly or monthly calls. Self-compassion. Give yourself the same kindness as you would to a loved one. For example, if a loved one was struggling, you would like to be there for them and would want them to reach out if they needed anything. Reach out to loved ones in the same way that you would want them to if they were going through tough times. Get physical. Go for a walk. Try simple yoga stretches or exercise. This is known to boost endorphins, dopamine, and other feel-good hormones while reducing cortisol, the stress hormone. Although it can be difficult, take some time to yourself. Schedule breaks. Be cognizant of your sleep routine and ensure that you can optimize the amount of rest that you are able to get. Find or create a calming environment for yourself. Different methods work for everyone. Everyone is different and it may take some time to determine what works best for you. That is okay. Keep doing your best and know that you are not alone. There are many resources to reach out to for help like the apps Headspace and Calm, or teledoc services like BetterHelp and Talkspace to speak with a licensed therapist. National helplines are also available. If you or someone you know is suicidal or in emotional distress, contact the National Suicide Prevention Lifeline at 1-800-273-TALK, or live online chat with trained professionals available 24/7. If you or someone you know needs general information on mental health and in locating treatment services in your area, call the SAM-HSA Treatment Referral Helpline at 1-877-SAM-HSA-7. Even though the past year has been chaotic, remember to focus on the things we can control. We hope these coping strategies help better navigate situations we are faced with in our everyday lives. Happy New Year to you from all of us at BU COVID-19 Response Corps.